A South African breast cancer NGO is looking to make history by performing the most breast cancer surgeries in one day. Project Flamingo is aiming to perform this feat in support of Mandela Day. The surgeries are set to take place at several hospitals in the Western and Eastern Cape. And to tell us more about this initiative, we're joined by the founder of the project, Dr. Liana Roodt. Thanks so much, Dr. Roodt, for your time. Now we know this feat is going to be attempted next, or performed rather, next Saturday, the 15th of July, 2023. And you're going to attempt an unprecedented number of surgeries in a single day, and you're looking at changing the lives of 27 individuals on one day. Tell us a little bit about the impact on the lives of these people and why they're so reliant on Project Flamingo for these surgeries.
Annie, thank you so much for having us. And yes, so Project Flamingo got born out of recognizing a need that our patients dependent on the public healthcare sector often have agonizingly long waiting times for their cancer surgeries. And we've been doing these so-called catch-up surgeries for the last 13 years. And in honor of Mandela Day, we really wanted to try and set a record. Usually we do about between 6 and 8 surgeries on a single day. But this Mandela Day, or in honor of this Mandela Day, we are going to attempt doing 27 surgeries across 4 hospitals. And I really think this has an enormous ripple effect, not just on the patients that's waiting for these life-saving surgeries, but also on their families and communities that is impacted by their disease.
Such an incredibly powerful initiative. Tell us a little bit about the medical professionals involved, because they're giving freely of their time and their expertise, and that's across various levels. It's not just the surgeons and the anaesthetists, it's the nurses, it's the NGO staff, it's a whole chain of people supporting this project.
Yes, this is really an absolute show of the generosity of South Africans. So the surgeons and anaesthetists all donate their time and their skill for free to make these operations possible. I think it's so heartwarming because we are so bombarded with stories, especially in the healthcare sector, where it seems that people don't care. But despite working in a very, very tired system, there are so many individuals that's got the heart and the generosity to offer this for free on a Saturday when they're supposed to rest and they're supposed to be off. And the NGO carries the cost of the nursing staff, and we carry the cost of the consumables and, of course, getting the patients to their surgeries. So it's an enormous team effort and such a beautiful showcase of what we really believe Mandela Day should be about.
So Project Flamingo doesn't only do operations for patients who are clearly desperately waiting for this life-saving treatment. You also directly strengthen the public health system by investing in essential infrastructure. Tell us a little bit more.
Yeah, you know what, when we started out, we thought, the big need is the surgeries. And as we go along, and myself also being a healthcare professional within the public sector and within the private sector, you recognize all these desperate needs popping up. And the project has grown all these amazing little tentacles where you realize, well, if we can just solve this little problem, it will have an amazing ripple effect that will change so many other problems. So for instance, just having an extra doctor in a breast clinic at one of our hospitals can see an additional 20 to 30 patients a week, which means increased access to care. Investing in ultrasound machines that can be used at the bedside for diagnosis can shorten the waiting time from the patient's first symptom to actually getting a diagnosis, which will then increase the time to treatment. Boosting staff morale and actually supporting our wonderful staff working so hard at the coal face makes an incredible difference. So these are small, tiny little differences that we can make that we really believe has an enormous ripple effect.
So all these incredible people and yourself involved in this project really are the heart of Project Flamingo, but you do need an engine, and that engine unfortunately has to be money. How do you get funding for Project Flamingo? Are you entirely reliant on donations?
Yes, unfortunately, if all of this could just fall out of the sky, it would be amazing. But yes, surgery unfortunately costs a lot of money. So with the healthcare professionals donating their time already, it's a massive win. The two provinces that we're involved with, the Western and the Eastern Cape, the Departments of Health has really been very supportive in giving us the infrastructure of their facilities, the hospitals where we are working. But there's still significant cost that needs to be covered. And yes, for that, we need donations. And we are so privileged that, even the smallest donation from family members of cancer patients, cancer survivors themselves, you don't have to go very far to find how people have been touched by cancer. And that really, the telling of the story and so many people being able to identify with the challenges of the story has made Project Flamingo possible. And for that, we're grateful.
Well, thank you so much for the work that you do. Good luck for next week, Saturday. We will be keeping an eye on. Hopefully we'll get an update from you once that incredible feat has been achieved. That was founder of Project Flamingo, Dr. Liana Roodt. For more information about Project Flamingo and how to support this cause, please visit www.projectflamingo.com.